Kia ora, I'm Dr. Eileen Sables from Tend, and today I want to talk to you about chlamydia. Chlamydia is not always cuddly like this. In fact, it's never cuddly like this. The problem is that 75% of females who've got chlamydia don't know that they've got it. They don't have any symptoms. The other 25% will get pain when they're peeing, they'll have vaginal discharge, they may have abdominal pain, they may have pain in the pelvis. But those other 3/4 of the ladies have got absolutely no idea that they've got chlamydia. So why would you worry if you haven't got any symptoms? Chlamydia can cause severe inflammation in the pelvis, which causes scarring of your uterus, scarring of your fallopian tubes. This reduces your chance of being able to get pregnant. And if you do get pregnant, you are more likely to have an ectopic pregnancy, which occurs in the tube or outside the uterus in other areas. Very dangerous. You acquire it through intercourse or through contact with infected vaginal discharge or contact with infected semen. So that can mean through fingers as well. It doesn't actually have to be through completed intercourse, and it causes infection in the vagina, in the pelvis. Rather than acquiring this little fella, why don't we use these instead? Because then you will prevent yourself from getting chlamydia. It takes about 21 days for this little guy to make himself at home in the vagina and start causing some symptoms after the sexual contact. So don't think if you've had unprotected intercourse you will develop your symptoms immediately. You probably won't. If this little fella also had gonorrhea with him as well, who was one of his best friends, then you may get symptoms around about the 14-day mark. You can also acquire gonorrhea or chlamydia from oral sex, so you can get it in your throat, and from anal sex, so you can get it in the rectum. If you are diagnosed with chlamydia or gonorrhea, then you should be contacting your sexual contacts who you have seen in the last 3 months to alert them of this so that they can be tested as well. Both of these are preventable diseases if we use these. Both of them are highly treatable if you do develop them.